So to get started, Melissa Anderson is a hearing psychologist and clinical researcher in the Systems and Psychosocial Advances Research Center in the Department of Psychiatry at the UMass Medical School. She completed her work just down the road from here, from NIH at Gallaudet University, where she studied intimate partner violence and trauma in the deaf community. At UMass, Melissa directs the Deaf Yes Center for Deaf Empowerment and Recovery, where she provides individual therapy to deaf clients recovering from trauma and addiction, and conducts research on adapting evidence-based practices and research methods to be more accessible and engaging for deaf sign language users. So Melissa, it's wonderful to have you do this webinar, and I'm going to turn this over to you now.
Thank you very much for the warm welcome, and thank you for bearing with us while we deal with tech issues. So hopefully now everyone sees the presentation and the journey we're going to be taking today. I'm going to be talking about an R21 that our team is currently working on that's funded partially through OBSSR and the National Institute on Deafness and Other Communication Disorders. And before we start, I do just want to give a brief intro on what is the deaf community. And this, given that you're down the street from Gallaudet, this might be a review, but I just want to make sure that we're all on the same page before we get started. So the deaf community in the United States is a socio-linguistic minority group of approximately 500,000 individuals who have some level of hearing loss and communicate primarily using American Sign Language. However, even such a basic statistic as how many deaf people are there in the U.S. Is not something that we have a lot of strong research on, given that various epidemiological surveys or census surveys use different definitions of what is deaf or hearing impaired, and it just makes it very hard for us even to know what is the size of our base population. But deaf people generally, culturally deaf people generally identify more as a cultural or sociolinguistic group rather than a disability group. And so this piece of art here really is meant to depict how labels and the concept of deaf identity has changed in the past century, going from a concept of deaf and dumb or deaf mute, hearing impaired, handicapped, instead to deaf people as a cultural group, seeing people who share sign language, they share history and experience. There's deaf art, as you'll see throughout this presentation, deaf literature, which used to be passed down through an oral storytelling tradition, and now with film can be captured via film. So what we're talking about today is really deafhood through a cultural lens versus deafness through a more medical lens. And like other sociolinguistic minority groups, what we are starting to see with the deaf community in the U.S. is pretty significant health disparities compared to the general population. And in recent years, there was the first American Sign Language survey to look into these health disparities, and they found that deaf individuals, when compared to the general population, were more likely to be obese, more likely to have experienced intimate partner violence, and more likely to have attempted suicide. And that was really one of the first attempts to get into this realm. And one of the reasons for that is that, as you'll see with this piece of art here, really the cornerstone of the deaf community and deaf culture is American Sign Language. And most of the research practices and procedures that we use are very reliant on spoken English or English literacy. And something that I think a lot of hearing people don't necessarily just grasp right off the bat is that the English literacy level in the deaf community varies greatly. And that's because individuals whose primary language is American Sign Language, they're learning written English as their second language. So one way to think about them is second language learners of English, except whereas we typically learn to read through, phonology and phonics, deaf people don't have the auditory access to that information, which makes it even more challenging. So often, the statistics that's quoted most often is that the deaf high school graduate has the median reading level is about the 4th grade. So that really has to be considered when we're thinking about how we try to include deaf people in our research, especially around the informed consent process, as we know that most of those consent forms are not at a 4th grade level. One of the other major barriers to doing more research with the deaf community around these health disparities is the oppression that deaf people have experienced perpetrated by hearing people, hearing medical providers, and hearing researchers. And this piece of art here is really about how the general population has tried to take away sign language from deaf people. And one of, our famous inventors in the hearing world is Alexander Graham Bell. We owe him a lot in terms of technological advancement. But Alexander Graham Bell was a very strong opponent of sign language. And he believed that deaf people should not be allowed to use sign language, that deaf people should not be allowed to attend deaf schools lest they, pair up and procreate. And very explicitly, he believed in eugenics to try to eradicate deafness from our population. And so he was quite effective in having American Sign Language banned from a number of deaf schools, and that's had a very lasting impact on deaf people. And that's just one example. That's one example of how hearing people have tried to take language away from deaf people. And that fear continues to this day. And so a lot of deaf people are afraid to attend medical appointments. They're afraid to participate in any sort of research because of this shared history of oppression. So now I want to tell you a little bit about our study aims for this R21. And we have over here on the left the sign for goals or aims. But the first step of our research is really to try to just engage with the community again, to create a partnership between UMass and the deaf community here in New England. And so we started that process with community forums that occurred last fall, in the fall of 2016. And for these community forums, we just invited deaf community members to come out and to talk about their experiences with the research world, both positive and negative, and to make recommendations to our team about how we can do better in the future. And for this process, we used a model called the Truth and Reconciliation model, where myself and then other members of the UMass or the research community who were hearing, we were there as representatives of basically hearing researchers, and we listened to people's stories about their negative experiences and really being, mistreated in the research world. And we issued an apology for what they had experienced, and then basically asked attendees how we could move forward, how we could make things better from here on out. And so that was what happened in the fall, and I will, in a couple slides, I'll share some of the results of what came out of that. But that was really just the first stage, just being open to listening and expressing a commitment to make things better in the future, to start to establish better relationships with the community here in New England. Right now, we actually just finished 4 of 4 focus groups with deaf stakeholders from across Massachusetts and Rhode Island to really focus on not general research experiences, but the process of informed consent. And what has that typically looked like with deaf people who wanted to be involved in research, and how they felt it should be done. And so what we're going to do with all this information, in starting next month, we're going to begin developing a training program to teach researchers how to recruit deaf people, how to enroll them in their research, and specifically how to do a much better job with the informed consent process to make sure that these potential participants are truly understanding what procedures are involved, what are the potential risks, what are the potential benefits, and making a truly informed decision about whether to enroll or not. And the goal here is not necessarily to target researchers who are doing research about deaf people. So yes, we do hope that researchers who have all deaf samples would use this information, but we're really trying to target general community researchers, hearing researchers who have very large samples or doing health studies, and they may have 1 or 2 deaf individuals who reach out to them who want to participate. And what we've often seen happen, and what our community forum participants and focus group participants have really said, is that usually if they want to be in a study about heart health or a study about smoking cessation or whatever it is, they reach out to a researcher or a research assistant whose almost automatic response is, we don't have funds for interpreters, you can't participate. And so what we really want to do is first target that process of how one can actually enroll a deaf person, and then how to make sure that that person knows what they're signing up for. So once we develop this training program over the next 6 months, then the final 6 months of the grant is that we're going to pilot test it with 5 research assistants from around UMass who have had no exposure to working with deaf people. And here at UMass, we have this cool simulation center where sometimes it's used for practicing medical procedures, but we're going to actually be using this simulation center to observe how research assistants do informed consent with deaf. We're going to call them standardized participants instead of what the term you usually hear in the simulation world is standardized patients. But we're going to pilot test it just with 5 research assistants to see, is this training program actually effective in improving their practices. So before I get too far, I do want to explain who our team is. So here's a lovely picture of us from the fall. But the entire team, except myself, and this is me over here, the entire team except myself is deaf. My co-investigator is from Brown University, Timothy Riker. And then we also have 4 deaf community advisors who are members of the research team. And you see their names listed here. Really, this is not an advisory group in the way that one would think of an advisory group where, you know, the researchers come up with the ideas and the procedures and then check in with the group for approval every now and then. Our deaf community advisors each work 8 hours a week. So they are active members of the research team, and really all the content, all the meat, all the ideas are coming from the deaf members of the team, not from me. That I consider myself more of the administrative lead who's facilitating the process, whereas the content is really deaf-led. So I want to share with you some of our community forum results, and I also wanted to show you how we've been analyzing our data. I can't actually show you any video data. I do just want to clarify that this screenshot you see here, there's no participants in that. It's myself, my co-investigator, and 3 certified deaf interpreters. But this is an example of how we coded data from our community forums, and I actually have screens 1 through 5 off because that would reveal participant identities. But each community forum, we had 5 cameras around the room, 3 aimed at the front, and then 2 aimed at the audience, so that individuals, if they felt comfortable, could come to the front of the room and express their opinions, concerns, suggestions, or some chose to remain in the audience and comment. And so we were actually able to capture all the communication happening in sign language around the room. And so what I've seen done with other qualitative research with sign language is that often the research team will translate from American Sign Language into written English, and then we'll code the written English transcripts. And what we did here instead was we decided that it was really important to be analyzing the primary language, to analyze the original message, not, you know, 2 steps down the line. And so we used, this is Atlas TI, which you can upload video data into, and you can qualitatively code right on the video using timestamps. And so using this process, I'm just going to share a couple of the themes that popped up most often. So the overwhelming response was that participants just felt like research that's for the general public, health research, biomedical research just isn't for me. And they all pretty much off the bat assumed that communication access would not be provided. And this isn't, you know, this isn't a misinterpretation. This is because of experiences that they've had in the past, but most often they have been denied access to these studies, and it's sort of become a learned helplessness that it's just not for me. You know, it just can't be accessible to me. The other theme that came up was just general mistrust of hearing people due to, you know, the history of negative or oppressive experiences. A third theme that came up quite often was the failure of researchers to report results back to the community. So everyone really felt like, you know, these researchers come in and they collect all this information, and they often would say, oh, you know, we'll let you know the results, or this is where you'll see them, and then a couple of years would pass and they wouldn't hear anything. And then fourth, participants really reported that they felt that researchers come into their community, take their stories, take their data, And it benefits the researchers, but the researchers don't make any attempts to give back to those participants or to the community in general. And I included one quote here, which is really poignant and in the moment, you know, really brought me to tears that this is how people see the research world. But I'll read it aloud. So this participant in sign language had said, you know, how will this research help us? It really won't. We've been trying so hard and struggling for such a long time. You're going to write an article about the results that'll help your job. You'll get paid, but how will that help us? You want us to share our experiences and use it to your personal benefit, but it won't help us at all. And I know that that quote may be off-putting, but it was really the general consensus of what people thought about researchers. And so, you know, since hearing these experiences and trying to be open-minded about it, one of our approaches in our research methodology, which is always changing, is that we're trying to, as each stage of this project is complete, summarize the results and quickly disseminate them to the community. And to prioritize that over professional publications, which is a tricky balance, you know, because we want to get an accurate summary out to the deaf community, and of course we do also eventually want to have professional publications, but we're really trying to prioritize the community over ourselves. And so here's an example of a video that we released. I'll actually, it might take some time to load, so I'm going to let it run while I'm talking, because it's in American Sign Language, and I apologize that I assume most of you won't understand what it says. But so this video we just released on yesterday, on Facebook, to summarize the results of the community forums last fall. Because we really just want the community to be well informed about what we're doing. We want to really exemplify transparency, and so far we already had, you know, 1,000 views of this video in just under a day. So you'll see in this, I'll just skip ahead. In this video we have various team members included. Oh, now it's buffering. But again, the goal is just to be as transparent as possible and to be disseminating information in American Sign Language. So I'll just skip ahead. So our next steps are that we just finished hosting our focus groups, each with 6 deaf community members, to really hone in on how to adapt the informed consent process for deaf people. And we just started analyzing that data. We're working on our qualitative codebook right now. Then starting in July, probably through January, we'll be working on our prototype training about how to deliver informed consent using an ASL interpreter. We're not going to be cruel and just stick hearing research assistants or hearing researchers in a room with a deaf person without an interpreter. And then we're going to use the simulation training rooms to see how it goes, to see does this training improve hearing research assistants' ability to interact with deaf participants. And ultimately, we hope to, you know, have that training that we can then test on a larger scale, hopefully with another grant later, but also just to produce a set of guidelines about how to enroll deaf people in biomedical or health research. So now I'm going to open up to questions. So I think I might have to minimize this so that I can see the chat.
You got it okay there, Melissa?
Yeah.
I've got a couple in my box. They might not have come to you.
Yeah, I don't see anything yet.
All right, so I'll read to you and you can read back then.
Yeah.
Make them to all attendees as well. I'm going to start with a question based on the feedback that you just showed. Typically among hearing participants, we provide feedback about research studies by written communication, primarily newsletters and that kind of thing. Are there reasons why that wouldn't be an acceptable form of feedback about a research study for the deaf community?
Yeah, so could everyone hear that question, or do I need to repeat it?
No, I think they should all be able to hear me.
Okay, great. So just thinking about, the English literacy differences between hearing individuals in the general public and deaf individuals in the general public, there's just such a wide range of English skills in the deaf community. And so even if you write a newsletter at, using plain English principles, being careful about your vocabulary choice, etc., it still probably won't be accessible to a lot of deaf people that we're trying to target. And it's also less engaging to deaf people. So it's not just about literacy, but, the core value of deaf culture is American Sign Language. So as much as possible, we're trying to take that concept of a newsletter and provide the same information just in their language.
Okay, that's really helpful. And probably something that most of us as researchers forget to think about. I put the two questions I have so far on the chat for all to see. So the first one is, how did the research team members get involved? Did they have previous experience with research?
So my co-investigator, Tim Riker from Brown, is a lecturer of American Sign Language and deaf culture. So this is actually his first involvement in a research project, and a few years ago I was working with a deaf postdoctoral fellow, and he connected me to Tim, and we all just started brainstorming about, what projects would have a large positive impact on the deaf community. And so that's how Tim originally got involved, and this is his first involvement in any sort of research study. And then the deaf community advisors, they have a range of backgrounds. So what we did when we were, when we found out we were getting funding, we sent out a general call for applications that was in American Sign Language, disseminated through Facebook and other social media, email. But one of our deaf community advisors is also a research assistant at UConn, and every year goes to Nicaragua to study the Nicaraguan sign language that's developing there. It's only 3 generations old. But all the other individuals haven't had prior research experience. So one of the other deaf community advisors right now, his background is actually in script writing and filmmaking, which is turning out to be very important for our group, considering that most of our recruitment efforts and dissemination efforts are in American Sign Language films. One of our other individuals works at a school for the deaf, but is also on the state association, on the board of the State Association for the Deaf. So her skill is really networking and outreach. So we have people from very different backgrounds, and they each have their own skill area, and it's actually a really nice mix of people on the team. this project is definitely something that could not be done without individuals from all those different backgrounds and areas of expertise.
Good, great, thank you. The next one I see here is, were there any representatives of the elderly population interviewed during the community forums? Was their feedback any different from the younger, less than 50 population?
So at our community forums, yes, we definitely had, you know, I'm just thinking back to who was there. There were deaf people definitely in their 60s and 70s who attended, as well as younger individuals.
Good. Oh, they're coming in now. You probably see them as well as I can. One of the other questions about this being a great presentation and excited to see the results when they come out. Do you plan to address that very real barrier of how to provide interpreters if you did train up the hearing researchers to include deaf participants?
So yes, that's a really good point. What's coming out of the focus groups is not only feedback for how to improve informed consent and how to train researchers, but now we're really seeing a need to also develop a training for interpreters. So one of the issues that actually came up during the focus groups was, is informed consent a legal issue? So in other words, would it be required to have a legally certified interpreter? And this is a big push in Massachusetts. I assume it probably is in DC as well, but for any legal proceeding, now you're not only required to have a certified interpreter, but it has to be a certified legal interpreter. And one of the issues that came up is, well, is informed consent a legal document, and what would an interpreter need to know to be able to interpret an informed consent form appropriately? And so what's coming out of that is that, no, it's probably not at the standard of requiring a legal interpreter, but probably the interpreter needs an hour or two of training on at least on the principles of informed consent to make sure that they're really hitting all these important points with participants. And the other thing that's coming out is that we really need some sort of national resource center. So if a hearing researcher has a deaf person that contacts them, then the hearing researcher can contact the center to find out, do I have any interpreters in my area, you know, or in my general location who have received training in informed consent and could do this work? Or the really cool idea, which, you know, we're thinking about how this could work, is potentially having deaf research assistants or deaf researchers who could be contracted out to do informed consent over video phone for that participant. So that's an idea we're playing with that we didn't expect to come out of the focus groups, but is super innovative.
Yeah, that's very interesting as a way to sort of bridge this, what's clearly a serious problem of being able to have deaf interpreters available when you have participants who are deaf.
Yeah.
There are a couple of questions here. I'll put them together and you can respond to them. Has anyone thought of the use of Braille or a tactile approach to help the deaf community about supporting reading? And I'm not sure I understand this one, but anyone talk to French researchers to see if they have any insights with the deaf community?
So first, regarding Braille, so, you know, Braille is developed for blind individuals, not for deaf individuals. And the issue is not so much that deaf individuals can't, you know, process what they're seeing, but that when we learn to read, we often sound words out. And if you don't know the sound that goes with each letter, if you don't have access to that audiological information, you're basically doing whole word reading in which you have to memorize each word. and what it means. And so that's one of the reasons why developing English literacy is so hard for profoundly deaf individuals or people who have been profoundly deaf from birth or a very young age. Braille definitely is used for deaf-blind individuals, and that's a subset of the population that has not received a great deal of attention, and unfortunately, our training will probably focus more on deaf participants versus deaf-blind, which requires a whole different approach. And then the question about, have we been in contact with French researchers? I actually am not, I'm not familiar with any French researchers, but if the person who asked that knows of someone that we should be in touch with, please do pass that information on.
That's really helpful. Good. As you were talking about the reading issues, it reminded me of a trip I made to Prague, and it's the same issue. I couldn't read the street signs because they're almost all consonants and no vowels. I couldn't pronounce the word. I couldn't remember the streets very well. It's a similar sort of issue, I think, here. So.
Absolutely.
Yeah. So there's a question here. If we are a hearing researcher who wants to investigate issues related to healthcare access and implementation of evidence-based practice for the deaf community, what kind of partners do you recommend we find for our team, aside from the obvious ones of having deaf team members?
Yeah, I think, I would absolutely advocate for having not only deaf team members, but deaf co-leaders. I think a lot of times, had I been just going off on my own, I would have made some common hearing mistakes, even though, I'm well-intentioned. But so just always having your co-leaders to be brutally honest sometimes is helpful. But also, I would definitely partner with stakeholder agencies. So if in your area you have independent living centers for the deaf, or I would partner with some sort of agency that has experience working with deaf people, and that is interested in whatever you're studying, because not only will they help guide the methodology, but then that will also be a huge help when it comes to recruitment. We here in Worcester, we partner with one of the deaf independent living centers, and when it came time to recruit for these forums, they were, printing flyers and mailing them out to all their consumers, and so having those partnerships with the agencies that already have deaf consumers is really key.
Good, thank you, that's helpful. There's actually a question from a group, including one of my staff that's at Johns Hopkins in their Mixed Methods Institute right now. And they want to know about the resources that are available now and when they could expect dissemination of your findings.
So I'd like to say really, really quickly, the prototype of the training program will probably be done in about January of 2018, and then we're going to test it with our 5 pilot participants in the spring. The hope is that then we'd be, testing it on a slightly larger scale before we disseminate. So I would say perhaps a couple years for that training. However, what we're hoping to do in the meantime is to establish a deaf access resource center that's really about how can deaf people receive access to participate in research studies. And so we're trying to get that up and running in the meantime, where anyone could contact us to ask for a consultation around these issues.
Good. Well, that would be great, and I think certainly helpful for a lot of the researchers in the field who don't have a lot of experience with this population. There's a question here about working with anyone at the Rochester Institute of Technology. You work with anyone there?
No, so we don't have any current partnerships with them, but I actually was just at a deaf mental health conference in Portland and connected with a few, so there might be some collaborations in the future.
Good, good. I had a follow-up question about the innovation of sort of a video phone chat, whether that's by FaceTime or Skype or whatever, remote access to deaf interpreters when researchers are trying to enroll them or consent them, et cetera, et cetera. It sort of occurred to me with all the Google Translate systems we have in place now for just about every language to every other language, has no one ever developed anything for oral language coming in via the microphone that turns it into an ASL video display?
It's so funny that you asked that, because one of the team members just last week downloaded an app that we were playing with where you actually do speak into it, and then there's a signing avatar who translates it into sign language.
Right.
And it's not bad. I mean, we were saying very basic sentences and things like that.
Right.
It's doable for very brief, very casual interactions.
Right.
But if you think about, so then trying to take that and apply it to a process like informed consent, having a discussion around those issues, I think it would be a lot more limited. But I do know there are folks doing a lot of research around signing avatars and things like that right now.
That's interesting, yeah. I always assume, especially for some of the complex medical terminology that you're trying to get across in an informed consent, that type of technology is not ready for prime time yet for that sort of
Yeah, absolutely, absolutely.
Good. Good. I don't see any other questions, so I think, Melissa, anything else you want to add before we stop then today?
No, I mean, I think I just, I'll move to this slide. So you can follow our progress if you want. This is our Facebook site where we disseminate information back to the community. You know, we're trying, our methodology keeps changing, you know, as we hear more from our deaf participants and our deaf team members. This really is a shifting process to try to really be engaging to deaf people and to not just fall into the patterns that most researchers fall into. So please follow our progress, see how we're doing, see what we're up to, and, you know, hopefully this work can continue and have some national impact.
That's great. Melissa, I want to thank you again for taking the time to do this today and for sensitizing us about these issues and greater inclusion and engagement of the deaf community in our research as we move forward. So
thank you.
Thank you. Okay. Bye, everyone.
Bye.